I trust the universe so much that my response to everything is it's fine, because even if it isn't, it will be.
It's a fringe phenomenon, but free birthing is on the rise.
You're the expert on your body and your baby. Of course you are. Who else could possibly know more about your body and your baby than you do?
Unlike traditional home births where a midwife is present, free or wild birthers go it alone. There's no medical intervention, no registered healthcare worker. The mother may have a partner or doula on hand, but those people only provide emotional and informational support, not medical.
When women are birthing unattended in the home, they don't have a clear pathway should something go wrong.
While the natural birth movement may be appealing to some, it can come at a great risk to mum and bub.
If a woman bleeds or if a baby needs to be resuscitated, they don't have the equipment or the training to implement first-line emergency care.
Tragically, 7 baby deaths have been linked to unassisted or free births in southeast Queensland and northern New South Wales since 2022, including 2 premature twins in Byron Bay who died just this month.
In Australia, we have poor support for home birth, so women have to pay a huge amount out of pocket. There's no Medicare rebate, there is no insurance for private midwives, so women are feeling they have no choice but to go it alone and free birth.
There's no data on the practice in Australia, but the rise of mums-to-be opting for free birth can be linked to a growing subculture on social media.
I free birthed my second baby at home in my bathroom.
I wanted an undisturbed pregnancy and an undisturbed birth without intervention.
There are certainly some big influencers that are actively promoting free birth, and there are a lot of desperate women who've been traumatised by previous experiences that are looking for an alternative that does not mean that they have to engage with a system that has previously felt very unsafe to them.
Nearly 1 in 3 women is traumatised after having a baby. 1 in 10 reports receiving disrespectful or abusive care.
It's time to stop pointing the finger at women, and it's time that the system had a long, hard look at itself. If we improved, then we are going to have very few women making this choice. Free birth is less about women and much more about us.
Everybody's individual decision is completely theirs because all of the inputs, your past experiences, traumas, how you feel about certain things inform how you decide things. So I think it's very hard to judge what somebody else wants to do in this situation because a woman has to feel comfortable, and if that's at home with somebody they trust, that's what it is. But this scares the crap out of me. The idea of knowing your own body, I get that. Yes, I'm the person that knows my own body. Now I know my own baby 100% because I've been with her 11 months. Before, when she was in here and I was in labour, I had no idea. Is she backwards? Is she upside down? Is a cord wrapped around her neck? I wouldn't have a clue what's going on. And the idea that I wasn't anywhere near anybody medically trained to make sure that they could step in and help me to give my daughter the best chance of coming out and nothing going wrong scares me to bits.
Yeah, I'm the same as well. I mean, going into childbirth, I had a bit of a plan, but that plan for me went out the window because you put yourself in the hands of a professional and, you know, make sure baby arrives okay.
Definitely.